it stands now, the so-called compromise bill will have no public option, no employer mandate, which requires that companies provide health insurance to their employees. At Town Hall, the president tried to dispel some of the Republican spin about government-run health care, especially Medicare, which was passed by the Senate 44 years ago today.
A lot of people have heard this phrase, socialized medicine, and they say, we don't want government-run health care. Nobody's talking about that. We're saying, let's give you a choice. You can choose the private marketplace or this other approach. And I got a letter the other day from a woman. She said, I don't want government-run health care. I don't want socialized medicine. And don't touch my Medicare. and I wanted to say, well, I mean, that's what Medicare is. It's a government-run health care plan.
Lots to talk about with Congressman Chris Van Hollen of Maryland. He's the chairman of the Democratic Congressional Committee, and he serves as assistant to the Speaker of the House, Nancy Pelosi. Chris, welcome to the show.
Great to be with you, Howard.
Chris, I know the House is doing a great job on this, but why haven't we seen Democrats in the Senate take a stronger bargaining position with the Republicans? Why give away something as fundamental to health care reform as the public option?
Well, you're absolutely right, Howard. We've got to have a public option in the plan that we send to the President's desk. We're all still hoping that the Senate Finance Committee bill will have a public option. If they don't, we're going to press hard. This has got to be in the bill that we send to the President's desk. We've got to create more choice for consumers and more competition for the insurance companies. I don't think anyone's surprised to learn that the insurance companies are fighting this. These are the same companies that have seen their profits go through the roof over the last 7 years. In fact, if you look at just the top 10 insurance companies, their profits have gone up about 430% over the last 7 years, while everyone's income stayed flat and while their premiums were going through the roof. So we've got to have a public option to create that competition and to give Americans more choice.
Some Democrats are saying that there needs to be compromise on the public option in order to get the bill passed, but 72% of Americans say they want the choice of a public option. Does that mean that what the American people want is already dead in the Senate?
No, I certainly hope not. It's certainly not dead with respect to the bill that we'll send to the President's desk. The American people are exactly right. If you want more choice, you want to bring down premiums, you need that competition. There are parts of the country where the private insurance companies have huge monopoly lock over the markets. We need to provide that competition. As the President said, we need to start keeping these insurance companies honest. You know you're getting somewhere when you get a lot of resistance. And as you get closer to making this happen, you get more and more fight from the insurance companies, and we have to stick up for the consumers.
Blue Dogs and Republicans are defending genuine ideological principles, restrained spending and constrained government. But they are also pulling in millions of dollars from health insurance companies, which are fighting for their lives and their profits. Joining us tonight is a former insurance company soldier from the front lines of this battle, Wendell Potter, a 20-year veteran of insurance public relations, most recently communications director for Cigna. He attended a Tennessee public health care fair in 2007 that turned his view of American health care upside down. Ideology aside, what motive do Blue Dogs and Republicans have to defeat the public option?
Well, I think the motive is to satisfy the expectations of the insurance industry. One of the things you have to keep in mind is that the insurance industry has been devoting a lot of time and attention and money as well to make sure that the Republicans are lined up behind them. And they've been focusing most of their attention most recently on the members that they might be able to persuade, and those include the Blue Dog Democrats.
Robert Zertelbach is a spokesman for AHIP, America's Health Insurance Plans. Today he said, quote, "For every dollar our country spends on health care, less than 1 penny goes to health plans' profits. We need to focus on the other 99 cents. Now, this guy does for AHIP what you did for Cigna. Any reason not to believe him?
Well, yeah, what he's doing is what I used to do when I was in the industry as well. It's misleading with statistics. A better way to look at this is that if we consider that we spend about $2 trillion on health care in this country, one of every $8, $250 billion last year passed through the 7 largest for-profit health insurance companies in this country. and they made
now
billions
is Senator
of
Bernie
dollars.
Sanders, independent of Vermont. He's a member of the Senate Health, Education, Labor, and Pensions Committee. Senator Sanders, thank you very much for joining us tonight.
Good to be with you, Rachel.
There seems to be a gap between the seriousness of what's actually being fought over in Washington right now and the level of discourse about it. Why do you think it is that there's so much sideshow craziness about this issue?
Well, number one, it is an enormously complicated issue. It's a personal issue. People feel strongly about it. Frankly, I think from our side of the aisle, we have not been as clear as we should be in what, in fact, we are fighting for. And one of the problems in that regard is, in my view at least, if we are serious about trying to develop a universal, comprehensive, cost-effective healthcare system, the only way you could wring the hundreds of billions of dollars of waste in the system today is through a single-payer system. But that is off of the table because of the power of the insurance companies and the drug companies. So if you don't do that, then it becomes pretty complicated, and it opens up opportunities for the extreme right wing to come up with their crazy ideas.
They're sort of filling the vacuum of the lack of details that people don't understand with craziness that people are willing to.
But what people do understand, Rachel, I think, is that our current system today is dysfunctional. You know, these guys are talking about, Democrats wanting to kill people. The reality is that 18,000 people die every single year in this country because they don't have access to a doctor when they should. Today, about 1 million families this year are going to go bankrupt because of medically related costs. You have people who are staying on their jobs who would like to leave because the job provides them decent health care today. So we have a dysfunctional system. We have got to address it. But in fact, once you don't do single payer, it becomes
Veterans Affairs provides both coverage and care to more than 8 million Americans. And what do the brave men and women who fought for this country think of American government-run health care? Studies and surveys consistently rate the VA's government-run health care just like Medicare's and better than that provided by private insurance. Our next guest is Phillip Longman. Phil, can you explain what the VA's government-run health care plan is and why it works?
Well, the Department of Veterans Affairs operates about 153 hospitals and some 900 clinics in every state in the Union and in many of our territories. It's the primary vehicle for providing care to veterans who qualify. I came to find out about it a couple of years ago when Fortune magazine called me up and asked me to find out for them who might be the Jack Welch of healthcare. Jack Welch, of course, being the fabled CEO of General Electric at the time. And I thought that was a pretty interesting assignment, so I went off to search for the Jack Welch of healthcare and discovered, as I looked around for innovation and who was winning the highest marks for quality and cost effectiveness in American healthcare, it was this institution that I couldn't believe could possibly be delivering these results. Because like many Americans, I didn't have much contact with it, and what I did know about it came from movies like Born on the 4th of July. But it turns out this is an amazing system and a really good news story for healthcare going forward.
Some insight last night, courtesy of John Stewart's Daily Show. Conservative pundit Bill Kristol talking healthcare, admitting the government does just fine running a first-class healthcare system for the military. It's just that the rest of the American people don't deserve the same.
So you don't believe no public option. So even though that's good enough for the military, not good enough for the people of America?
No. Well, the military has a different health system than the rest of Americans.
It's a public system, no?
Yeah, they don't have an option. They're all in military health care.
Why don't we go with that then?
I don't know. Is military health care really what you... Well, first of all, it's expensive. I think they deserve it, the military. I'm not sure...
But the American public do not.
No, the American public do not deserve the same quality health care soldiers fighting in Iraq and Afghanistan deserve, and they need all kinds of things that the rest of us don't need.
Well, no, they can have the level of care, but are you saying that the American public shouldn't have access to the same quality health care that we give to our better citizens?
Yes. To our soldiers? Absolutely. American public...
Really?
I think one thing, if you become a soldier,
Should they have nicer houses?
No, they don't have as
Should they
nice
get paid
houses,
more?
John. Maybe you're not aware
No,
of that.
I'm
They
saying,
get paid
should they?
less.
Well,
They
that's
get
what I'm
paid less.
saying.
So one of the ways we make it up to the soldiers is and since they're risking their lives, we give them first-class health care. The rest of us can go out and buy insurance.
So you just said
as 90% of us have. As 90% of us have.
I just want to get this on record. Bill Kristol just said that the government can run a first-class health care system, and that a government-run health care system is better than the private health care system.
I don't know if it's better. I don't know if it's better.
No, you just said it was better.
I don't know if it's better all
No, you
around.
said it was better. You said it's the best.
The military
it's a little more expensive, but it's better.
The military need different kinds of health care from the rest of us.
So the government, I just want to get this down.
Write that down.
The government runs the best health care.
I will support you in arguing for better health care for the military if they're in any way being deprived of it.
I understand that. So what you are suggesting is that the government could run the best health care system for Americans, but it's a little too costly, so we should have the insurance company health care.
No, what I'm suggesting is our soldiers deserve better health care than the rest of us because they're risking their lives.
I agree with you.
They're not in the same situation as all the rest of us.
They have the best government-run health care money can buy.
That could be. I hope they do. I'm not sure the VA, for example, which is another government agency, has the best health care.